And we're speaking this morning with Dr. Tim McKnight as we talk with the doc this morning, live on the phone this morning. Hey, Dr. McKnight, good morning, first of all. And
Good morning.
when I saw what we wanted to talk about today, the first thing you said was the silent killer. And fortunately, I know what that was, but sometimes it's called that because it kind of sneaks up on us. So what about hypertension, and what's that got to do with this insulin rejection or whatever that is?
Well, it's the silent killer because most of the time people don't know they have high blood pressure. And again, we're talking about things I'm seeing in the office, people that come in and we're trying to determine, do they really have high blood pressure? Is it white coat hypertension, white coat syndrome, or, is this potentially serious or is it not? So it's really, really critical that we diagnose it correctly and then we treat it when the blood pressure is too high. And so the question is, what is hypertension? When is it too high? And the answer is, anytime the majority of your blood pressures are greater than 140 over 90, that's too high. Now, you can be up to 160 over 100 and maybe not even feel that. So there's this whole range there where you not even feel symptomatic. But every time your heart beats, it's stretching the blood vessels, the arteries, and the pressure is so high that it's causing some shear force injury to the arterial lining, and it's progressing the development of atherosclerotic plaque. It's putting you at risk for aneurysms that can rupture, and it's damaging the lining of the arteries, and it's damaging the kidneys. So it's something that we have to be careful of. We have to treat it if we can't get it down.
Mm-hmm. There are natural ways to get it down, though?
Well, there we go. Yes, perfect lead into insulin resistance, because insulin resistance, we've talked about a number of times now, is when the insulin cannot get blood sugar into your cells, and so the cells start to panic, and the cells become stressed, and they secrete all these stress hormones. We call them cytokines, and those cytokines cause further inflammation and can elevate blood pressure. And particularly, those cytokines and those stress responses are most prevalent with obesity. So the bigger we get, the more overweight we are, the more those cytokines and those inflammatory mediators make this condition worse. So the first treatment is try to achieve an ideal body weight. Even if you're 20 pounds overweight and your doctor's telling you, hey, you're 60, you got hypertension now. You can deny it, but the fact is they're probably right. You probably do have hypertension, and the first thing you need to do is get rid of that gut, get rid of those inflammatory mediators that are caused by insulin resistance. And as you reduce the excess weight, you will reverse the insulin resistance. Then insulin works, and the inflammatory response goes down. So that's always, always, always the key thing people need to do. I saw somebody in the office just the other day who sort of fit this description, and this patient did not have had an ideal body weight, was in their 60s, but was having issues with hypertension. So sometimes it's not as simple as, lose the excess weight. There are other reasons this can happen, one of which is sleep apnea. There's so many people that have sleep apnea that don't know it or can't tolerate the treatment that it continues to happen to persist. And this also causes arterial lining inflammation and the arteries, the muscles in the arteries to contract and not be able to stretch with each pulse of the heart through the arteries. So that has to be treated. Some people have chronic kidney disease or kidney conditions, and the kidneys are a key organ in helping to regulate blood pressure. So when your kidneys are healthy, they secrete hormones and other messengers to help regulate blood pressure. That's why in primary care, if we can't control blood pressure with 3 or 4 different types or categories of medication, it's time for us to admit that we're not getting there, and we need to send the patient to a kidney specialist who really, they are the ones that are sort of the experts in controlling high blood pressure when primary care physicians can't do it.
It's interesting.
So again, these are things that the American Heart Association has set out guidelines and standards. And really, the goal now is to keep our top blood pressure, the systolic blood pressure, under 120, and the bottom or diastolic number to be less than 80. So 120 over 80 or less is now considered normal. if your blood pressure is 125 over 82, that's considered prehypertension. Um, I personally have a problem with that because I know for myself, if I treat my blood pressures to fall in that range, I feel awful. I get lightheaded with exercise. I get short of breath.
Yeah.
I don't feel well. So I don't know if this is part of the allopathic approach and the influence of the pharmaceutical companies in sort of having a say in these guidelines, because I'm not sure that needs to be the guideline. But clearly, we know that when the blood pressures on average tend to run higher than 140 over 90, there's damage being done to the heart, to the arterial linings, to the kidneys, to the eyes, and to many other organs. So we just absolutely cannot tolerate blood pressures greater than 140 over 90 the majority of the time. And that's what I'll tell patients to do is get a blood pressure cuff and check it periodically, different times of the day under different circumstances. And if every now and then you have a blood pressure that's 150 over 92, which sounds high, but the majority of your blood pressures are below 140 over 90, we're not going to chase after those occasional high blood pressures. We are not machines. We're not going to have perfect blood pressures under every circumstance. And to treat those blood pressures that occasionally run high, especially when somebody comes in the office, when they're already kind of revved up and a little bit anxious, that can lead to failure, because what happens is now we're treating someone who really has a normal blood pressure, but just runs high in the doctor's office with medication that drops them too low and they don't feel well.
Would you call the range between 120 and 140 maybe like a yellow flag rather than a red flag?
I definitely would not call it a red flag. I'd say maybe 130 over 40, 130 to 140 on the top number, and high 80s, 85 to 92. Mm-hmm. I'd call that sort of the yellow flag area where, we need to watch that close.
Yeah.
We need to be getting some good, reliable readings. And sometimes people can't do that. And if I need to really assess what's going on, we can put a 24-hour ambulatory blood pressure cuff on the patient, have them wear it for 24 hours, and it'll randomly check their blood pressure every 30 minutes or so. And we get a really good reading. And, of course, the blood pressures go down at night when we're sleeping. They tend to be up a little bit in the day, and that's normal. That's what the body's supposed to do. But it's just crucial that we don't allow that blood pressure to run high, because we know that starting at a blood pressure of 140 over 90 and higher, if you look at the mortality curves, it just goes up. I'm not going to say exponentially, but there's a significant rise in all-cause mortality the higher those blood pressures come or go. So that means stroke, that means heart attack, that means sudden cardiac death, that means kidney failure, that leads to other problems that can cause somebody to die. So, again, 140 over 90, if it's consistently above that, you really have to do something about that. First thing is lose the weight. Second thing is make sure you don't have sleep apnea if you do have that treated. The third thing is exercise. And then there's all these other lifestyle things. Some people believe that too much caffeine can lead to this. Clearly, chronic sleep deprivation can cause the blood pressure to be high. And we've talked about this before, but another really important molecule that can help relax a blood vessel lining so that it can stretch is nitric oxide. And we know that alcohol will block our ability to make nitric oxide. We know that when nitric oxide production is low, men develop erectile dysfunction, and women have the same issue. So if a woman or a man is having erection issues, they need to be watching their blood pressure, because it's probably starting to run at least borderline high, and that needs to be managed correctly.
Is there a certain age that you think people should definitely start testing themselves more often because of the new information about insulin resistance and those sort of issues?
Well, I don't think there's any particular guidelines on that yet, but if you're diabetic or pre-diabetic, you need to be watching your blood pressures close, and that can happen to a 25-year-old, especially if you're overweight and you've got a family history of diabetes, say a sibling or a parent that's got diabetes or borderline diabetes, and you become overweight, the chance of you becoming diabetic is extremely high. So for those people, I would definitely watch it closely. For most people, we're supposed to screen these people, every couple of years in their 20s, and then by the time they're in their 40s, it should be a yearly blood test that we're looking at their kidney function, we're looking at their liver health, we're looking at their blood pressure and monitoring from that point forward. So unfortunately, there's a lot of people out there that feel fine but don't realize that these blood pressures are creeping up. And maybe they're 20 or 30 pounds overweight, but when they look around at their peers, they think, well, I'm pretty average and pretty normal. But 30 pounds overweight can be enough to really make a difference with blood pressure. And conversely, when you start to lose that weight and you get closer to your ideal, it can be the cure for hypertension. So again, it's a healthy lifestyle and an understanding that insulin resistance, not only does it lead to hypertension, but it increases your risk for diabetes, increases your risk for high cholesterol and heart disease, hardening of the arteries and heart attacks, increases your risk of stroke, increases your risk of dementia. And these conditions go on and on and on. So we definitely want to try to prevent these conditions and reverse them when we can. And then sometimes, and I don't know the exact figure, but in my experience, 25% of the time, 10% of the time, even in spite of all these lifestyle changes, it's going to be high and it's going to need treated. Mm-hmm. But for the majority of people with the healthy lifestyle and doing the things that we talked about, they don't have to be on 4 or 5 medications. They don't have to suffer from this. But it takes a lot of willpower. It takes good information. It takes understanding the body. We've talked about women who start gaining weight at menopause. They often develop hypertension with this extra weight gain, and that's not always. You can't tell a 50-year-old woman who's gained 20 pounds since menopause that she needs to exercise more or eat better, because she's probably doing pretty good with those things already. She doesn't need a lecture. She needs somebody to understand the role of hormones, get the hormones corrected, so that then when she starts to eat better and she starts to exercise, the weight's able to come off. Yeah. So, it's a crucial problem, very, very common. And I guess my message to folks is to keep an eye on your blood pressure, know when it's running high, talk to your primary care provider. Don't overtreat it, but do those things that can reduce the blood pressure and maintain normal health of the blood vessels and keep the kidneys healthy.
All right. Well, Dr. McKnight, as always, treat your body well, and it will treat you well, I guess, won't it?
Absolutely. The body has been designed to heal itself. And if we do the right things and get out of the way of some of our bad habits, it will continue to heal ourselves, and we'll do things that we never imagined as we get older. And that's what I hope people will start to believe and to experience.
There you go. Hey, well, thank you for your time as always, and we'll talk to you next week, all right?
All right. Thanks, Brett. Have a great day.
You too. Thanks a lot. Dr. Tim McKnight this morning as we talk with the doc.